So I'm Terry Lee Kelford. I'm going to be the moderator for the session today. So glad to see this many faces in the room. That's great. We've had a unfortunate accident. I don't know what to call it, an accident, a miscommunication or something. So we thought we had a third presenter today, but apparently they got rejected. And so they're in the program, but they won't be presenting today, which is really unfortunate. So if you see 3 people in the program, there's only 2 presenters today. So that will give us more time to be able to talk and hear from our presenters. So they've arm wrestled and argued over the order of today's presenters, but they finally agreed on one. But so I dislike having to wear glasses while I read. But so our conference today. How many people have been at the conference more than just this year? Multiple years? Yeah, me too. Yeah, it's been a long time. Huh? Is it 10 years or 11 years this year? I think 10 years.
11 years.
11 is it 11 now? Yeah, it's a long time. So the 2024 National Conference is back in Ottawa, and it's on the traditional unceded territory of the Anishinaabe Algonquin people. And I actually have the fortune of living and working in Lanark County as well, which is also on the same territory. So important to acknowledge our lands. The peoples of the Anishinaabe Algonquin Nation have lived on this territory since time immemorial. Their culture and presence have nurtured and continue to nurture this land. We acknowledge and celebrate the many First Nation, Métis, and Indian people Inuit people from coast to coast who participate in the conference and lead to the work to end homelessness across Turtle Island. So welcome. So presenters today. Oops, sorry for that loudness. Switch to bios. I'm going to keep hitting it because I have ADD and I talk with my arms and I'm all over the place. So we have the first 2 presenters today are Kandis and Janice Fraser. So Janice.
We're not married.
You're not married?
No.
Kandis Stradecki. Janice Fraser.
Janice was raised in Halifax, Nova Scotia by teenage entrepreneurial parents. And because of their support, she was the first on both sides of her family to graduate from high school, let alone a university degree, which is very cool. Good for you. Her Bachelor of Arts program, cum laude, from St. Mary's University, Halifax, focused on the sociology and economics of gender equity, systemic change, and women in the workforce. One of her first graduate jobs was interviewing for the Municipal Neighborhood Improvement Program in the north end of Halifax. Janice has raised 3 amazing sons on 2 different continents and spent decades advocating and working on behalf of vulnerable people, especially people with developmental disabilities. She thrives building healthy supports and infrastructure that ensures not only equality but equity of access. As a constituency member for the manager for the 2 Alberta MLAs, she learned to negotiate often competing aspects of social services and provincial programs, economic, corporate, and environmental interests, business priorities, economic fluctuations, and limited grant funding, 3 levels of government priorities, complexities of legislation, and the vast nonprofit NGO world. Janice worked diligently as the Faith Link coordinator at the Alliance to End Violence Calgary, as project coordinator for the CRHF Tamarack Transit System project in Clearwater County, as well as project coordinator for Voices for Gender Equality by survivors of gender-based violence and the Indigenous Wellness Support Project at the Mountain Rose Women's Shelter Rocky Mountain House. Janice is a proud fire starter facilitator for Mending Broken Hearts and the Medicine Wheel and 12-step Wellbriety program. It's a really cool word for it. I like that. As well as Stewards of Children, Little Warriors, In From the Cold, Divorce, Care for Kids, and the Road Ahead Society. As a lifelong learner and enthusiastic community volunteer and volunteer board member for numerous nonprofits, Janice has balanced her life energy with cycling treks through the Rocky Mountains, hiking, completing half marathons and Olympic triathlons to strengthen and keep up the fight to do the right thing whenever it is within her means to do so. Janice's next goal is to support the Clearwater Regional Housing Foundation, find viable solutions for public transportation geared to fill the gaps in services and health outcomes in rural Clearwater County in order to augment innovative, accessible housing solutions. Amazing and impressive. Okay, Kandis. Kandis, born and raised in one of the oldest towns in Western Canada, Kandis has spent much of her life living and working in rural or remote communities within Alberta. With over 30 years of experience in the social work field, she's worked with community grassroots organizations to develop local solutions, including, is it HERA or HERA?
Yeah, HERA.
Healthy Families Visitation Programs, daycares, the Clearwater Boys and Girls Club, and the Clearwater Regional Housing Foundation. Throughout her career, she's been employed with community and nonprofit organizations, government agencies, and Alberta Health Services, and has worked in rural, remote, urban, and inner city communities. Kandis has practice experience in child welfare, foster care, adoption, women's issues, mental health, persons with disabilities, and working alongside of First Nations communities. Currently, Kandis is employed as the mental health liaison with Recovery Alberta and works at the Rocky Mountain House Health Centre. In this role, Kandis is actually aware of the hidden homelessness that exists in rural communities, the negative impacts upon social determinants of health due to homelessness and societal biases that impact those who are marginalized within smaller communities in Alberta. Kandis believes strongly in living congruently with a focus on mental health and can regularly be found swimming on her lunch hours, sitting outside in the sun, enjoying the sounds of birds or hiking in the mountains. Although she's a passionate advocate, what continues to get her out of bed most mornings are her Spitfire, Westie, Terrier, Winnie, and her baby St. Bernard, Charlie. So welcome to both of you. Do you guys want to do questions after your presentation or at the end?
Do it after.
We can do it right after, I guess. Okay. Now, he said start the slideshow. Did it go? No. Slideshow. From beginning. There we go. Okay. Well, as you heard, this is a bit of a deviation from how we thought this was going to go. I thought I was going to be like in the last presentation and, you know, relaxed and calm after everyone else had gone. So I'm just going to start us off with the Tamarack transit system and give you a bit of a background about how we came to be doing this program. So, originally, we thought we had about 20 minutes for all of us to do our presentations because there was to be 3 of us. It looks like that it could be stretched out a little bit, and so then we're going to do the questions immediately after. So what we want to do is just talk about the background and the context of our project as we're trying to seek solutions for transportation and concurrent social health concerns. So we intend to talk about a little bit more about the background, the objectives of our presentation, the vision of our agency, if we can call it that, because we're just at the beginning stages, the methodology of our project, some of the challenges that we faced along the way, the model for implementation, and then what our next steps would be. Sorry. Okay. So the Clearwater Regional Housing Foundation is, as I mentioned, just in the beginning stages of what we hope will become a viable agency. The mission of our foundation is really to be a credible and respected collective voice regarding the housing needs in Clearwater region and to provide collaborative leadership in housing options and opportunities that will meet economic and social challenges. Our vision, moving towards that end goal, is that all people in Clearwater region will have successful housing that is suitable to their life stage. So one of the things that happened, Clearwater Regional Housing Foundation actually came out of a body of research that I see 2 of our colleagues at the very back of the room. It really came out of some research that was done through, at the time, Alberta Rural Development Network and Mountain Rose Women's Shelter, which is now the Mountain Rose Centre. And then we had also some corporate sponsors that were involved along the way. And what that research showed us was that really homelessness is largely hidden in rural Alberta. And we also learned that we have kind of pockets of homelessness. And so when we talk about, and I know this is not a unique experience, when we talk about rural Canada and we talk about pretty much if we were to draw a latitude from Edmonton north and then kind of west in most provinces, we know that we have large geographic areas and we know that homelessness continues to be largely unseen. And so what came out of that research is that we saw very definite fluctuations in Alberta that were dependent upon the economic cycle. And so I'm not sure how many in here are from Alberta, but I'm sure that everybody has heard in Alberta we have a boom and we have a bust. And so at that time, what was relevant about the research was really that we didn't have enough housing for the people that we needed in order to do the jobs that were available. And then shortly thereafter, what happened is that we went through a bust cycle, and then we still didn't have enough housing because the housing needs actually changed. People could no longer afford the kind of housing that they had, and then dramatically right after that, we had COVID. And then we've seen that actually grow exponentially in terms of just the changing needs for housing and the affordability of housing. So one of the things that came then from that research was the recognition that really we needed to work differently, more collaboratively within our community and within our county. And I'll go through some of the demographics about what our county reality is. Again, I think not unlike many other rural jurisdictions. So coming out of that collaborative work, what we have come up with and what has been kind of fruitful for our community is what we call stone soup. And the idea, does everybody know what the stone soup story is? I see some nodding and some shaking, so I'll tell you. The idea, stone soup is really a bit of a historical sort of parable, if you will. And what the idea was is that two strangers came into a town and they had absolutely nothing except what they were wearing, but they were hungry after their long, long travels. And so when they came to town and they were asking if others could share with them, and others were saying, I don't have enough to feed two more at my table. And so then they came up with the idea that what if we all shared and we came together in a gathering and everyone put something into the pot. And so when that was then proposed to others, they were like, yes, I can do that. I have a carrot, I have a potato, I have the water, I have the bone that can make the broth. And so the idea is that when we all come together and we share what we have and what we can bring to the meal, we all profit and we can all eat. So what we did then is we took that and we said, okay, how can we bring everyone together and what can we learn? And so the Stone Soup for Housing is really one of the community engagement strategies that we use. Along the way, through our development, we've completed 3 of those, the most recent being in March of this year. And every time that we've done that, we've learned something more about how things have changed within our county and within our community and what the needs are by and large. So it's been both an opportunity to engage and report back to the community about the work that we are doing as a foundation. Coming from those sessions and congruent with the Clearwater Regional Social Master Plan is that transportation is a process priority that will help to address social needs and gaps, such as employment and job training, housing, access to medical, mental health, and addiction services, and then also to emergency services, such as those needed when we have people that are fleeing domestic violence or gender-based violence. And I think that what's really important is that we didn't always have an idea of what that was going to be. And as a foundation, as I say, because we're in the beginning stages, most of us, as I was introduced, I have another full-time job. This is kind of off the side of my desk. I see faces smiling. So this is a common experience for those of us in rural province, right? But it doesn't mean that we don't continue. It means that we need to be patient with the process because we know that it takes us a little bit longer sometimes, but it's still good, it's grassroots, and it's solid because it's community-based and it's community responsive. So,
Just wondering if I can
Yeah.
interrupt, Candice.
Yeah.
We have the wrong PowerPoint, so I'm just wondering if we could just switch it, Mr. Tech, here from my laptop.
oh,
We won't be able to use secondary laptops. You'll have to transfer it to a USB stick.
I've got a USB stick.
That's okay, we'll
I've got
just
a
carry
stick.
on then. So we'll just,
Here,
I'm
I've got
fine.
a stick.
you have it, well.
this
I'm-
is sort of the draft that
Take it.
we're
Right.
doing.
I've got a stick.
So-
Text.
Just carry on, Candice,
Okay,
and then
so then, as I was saying, we learned that transportation is actually one of the process priorities that came out of our community consultations, or our student soup, consultation. That was a recurring theme over and over, no matter what we did. And so when the opportunity arose to apply for the Rural Transit Solutions Grant, the FCSS director and I, and I'm hoping that everybody knows what that abbreviation is as well. That's our Family and Community Support Services in Alberta. Our local director, she and I collaborated then to complete the proposal. And as you'll see in Janice's sections of the presentation, what that allowed us to do was really very grassroots, local-based research that would then hopefully inform a local solution. We're about to transfer. Okay. So our other slide presentation has these wonderful graphics in it.
It was a beautiful picture of the rural
Has lovely
community.
pictures.
And then a beautiful map of what Kandis is not going to.
Thank you so much. Yep, that looks right with graphics. And be on slide 4. Yep,
We'll go
that's
back
the
to
one.
3 and show that picture.
Okay.
There you go,
Okay.
guys.
There you go.
All right, thank you.
Thanks.
So this is, we included pictures so you'll all have a sense of longing and want to come to visit. You know, it's beautiful where we live. And so this is just one of the local lakes where Janice and I would often be found hiking the circumference, really, of the lake. So as you can see, this is our rural reality. That represents our county. And you can see that from Red Deer west, we touch upon Banff and Jasper National Parks. So you can appreciate how large this space is, kind of how remote this space is. We kind of move back and forth, as I said, depending on the economic cycle that we're in. Our overall population within that county, within that space, hovers between 24,000 and 26,000 people. And so we're kind of spread out because there's approximately 6,500 people that would live in the town of Rocky Mountain House, which is kind of the hub within that county. So the county, it includes what we call rural condo developments. That's how our county categorizes them. Really what that means is that we have different pockets of acreages. They're acreage developments, right? And then we have larger farms and ranches. There are 3 reserves that have property or residents within that county. So that being Sunchild, Ochise, and Bighorn First Nation. Bighorn First Nation is actually connected, if we use the term how the crow flies, they are actually connected to Morley First Nation. So when we are talking about any type of work with First Nation communities, we also would need to include Morley First Nation, who I think most people know is west of Calgary. As well, residents of our county include those associated or have residents with the small boy camp, which are family constellations, essentially, that continue to live more traditionally and more nomadic, except for the winter months when they have an actual camp. And then we have hamlets and villages, and including the town of Nordegg. This is significant because each of these population pockets represent different community needs, jurisdictions, whether it's town, village, or hamlet, in terms of what we need to work with, and then also considerations of federal versus provincial jurisdictions. So then if we were to talk about some of the other demographics, in terms of our aging population, which again we are seeing across much of Canada, in rural areas especially. So 39% of the population on our county is age 50 plus, and 30% of the population in the town of Rocky Mountain House is age 55 plus. Of significance about this is that our income actually falls above the national average. So the median income is noted to be $101,000 per family income. If we take a look over all households, it's $95,480. And the average income, and so this is important because we're talking about a range, and this is the average income per household is noted to be $181,030. Yes, I see, yes. The difficulty is that the range, because that's right, it's great. No, there's kind of no middle. And that range then drops to $30,000. And so what happens is when we discuss planning or we talk about social needs, a lot of people look at us like, what are you talking about? Everybody has a truck. Everybody has 3 TVs in their house. Everybody has multiple vehicles, and we go on vacations multiple times every year. So when we talk about data and we talk about what we need to inform people about making change, it becomes very critical in our case. So when we talk about things with people on our town council, again, our town council, county council, lots of them come from that position of, we'll say, affluence. So when we raise issues such as planning for housing for those who might be marginally or vicariously housed, or those who have other barriers, they don't necessarily recognize the barriers themselves. So one of the things that we've talked about, here's an example of a barrier. Somebody whose family cannot afford to live in Rocky Mountain House because they cannot afford the cost of rent there, and they live in one of the smaller villages or hamlets. If they have an adolescent who needs to get to a job placement, for example, they have no transportation. They have no way of getting there. So we're losing out on human potential and development because we don't have a viable transportation system. Another example would be that our data, and actually if you were even to look up our county or our town, the data would tell us that there are approximately 1,080 individuals within the county and town that live hovering around the poverty level. What's important to recognize about that, because everyone always says this and it's quite a bias, is that everybody's like, well, you have 3 reserves in your county. Of course that's true. No, that data does not include information coming from the reserves. So if we were to factor in families who live on the reserve, those numbers are actually higher. So I think what most people don't recognize, because I know this is in the national news, the living wage that we would all have in order to just kind of have a reasonable standard of living, in Rocky Mountain House in 2022, that was noted to be $21.50 per individual, or $15 if you were a 4-person family. Because what that assumes then is that you'll get child tax benefit and GST and all of those kinds of things, so it would offset that. That number, though, changes dramatically and worsens when we know that transportation costs have to be factored in from individuals, right, who are having to come into the town itself. So really what we're hoping out of all of this is that the data and the research that we did through this project will help to inform future systems planning for transportation needs, and that will also then inform how it is that we talk about and plan around the housing gaps. So what we hoped for when we did the initial proposal is that what we were going to build was a sustainable rural transportation system, and one that we would be able to share. Ideally, that we would be able to link our county to other counties around us, and that we would have something that would be quite viable, that we would be able to use as a model, possibly within other rural jurisdictions within Canada. So what we're hoping, as I've said, a transformative rural transit system, because as it is right now, especially in rural Alberta, it's like, well, you just get into your Ford F-150 or your Chevy and you drive on down the road. Everybody has that experience. As I said, there's kind of an assumption that everyone has that degree of affluence. We would be integrating needs and aspirations then and enhancing the quality of life for diverse communities. As well, we would be hoping to have sustainable practices, collaborative partnerships that would catalyze economic development and also environmental stewardship. We know that one of the things that we've seen happen since COVID in our area is that domestic tourism has really exploded, actually. And so we represent the 3rd corridor that would take you to the Banff-Jasper corridor. And so when we talk about this, one of the things that's important is for us to be able to do things that are in a way that would not have us lose control of the West Country. And when we say that, because we have learned some things from the Canmore experience, we also know that when we have the boom and bust cycle, we have a large number of people that end up being very transient. And so we want to try to avoid some of that. And then just looking at building upon economic prosperity and sort of planning for the next 30 or 50 years within that corridor. So transportation was really a key component to make that happen. Okay, and I'm going to turn it over to Janice. She's going to talk about the nuts and bolts of the research.
So I do want to just take a moment at this time in the presentation to give our thanks to Rural Transit Solutions. It was a federal grant that we received from Infrastructure Canada. And they gave us the opportunity to develop a comprehensive, interconnected, and a locally driven transit plan and design that we called the Tamarack Transit System Project. This project has been responsive to the needs of our most vulnerable populations, but as well has increased the potential for a transit option for the entire county. So the methodology that we used was a comprehensive literature review of prevalent rural transit and shared ride systems across the country. And we followed a mixed method, multifaceted research design to gather qualitative and quantitative data, particularly lived experience. Data that would be most relevant to the development of an inclusive, accessible, affordable, reliable, and efficient system, highly responsive to the local needs. So in consultation with community and government liaisons and regional public transit experts, a nonprofit collective hub model addresses our unique gaps and meets the challenges of low population density within a massive remote area. Another thing we did is the extensive community engagement sessions that ensured our plan aligned with the diverse county needs, including an aging demographic, and fosters interconnectivity, as mentioned, maybe also outside our county with other counties, hub upon hub, spokes in a wheel, serving West Central Alberta. So the accessibility and inclusivity while avoiding abandoned hamlets due to economic resource and service depletion, because that is the threat that looms over some of our more rural areas in Alberta. Sessions were also held in 4 community hubs: our one and only town, Rocky Mountain House, our one and only village, Caroline, and 2 thriving hamlets, Nordegg, our mountain gateway, and Leslieville. And these centers were determined to be geographically and demographically situated to inform a strategic design. Engagement sessions, and some in this room attended some of those, were held to include the lived experience of our vulnerable people. People who are unhoused or precariously housed, seniors, women and children fleeing domestic or intimate partner violence, people who are food insecure, and those accessing our mental health and addiction supports, and our newcomers. Formal presentations were also made to municipal councils, our MLA, and our Minister for Seniors, Community and Social Services, local taxpayer associations, energy, business, and agricultural stakeholders that are key to our economy. At a resource table we had at the Rocky Trade Show, of 1,500 attendees, we were able to query 500 people directly, and not one said that they were not in favor of a public transportation system. Imagine a world with no public transportation. A town hall gave an opportunity for feedback and a preliminary report of what was heard and learned, and resulted in a focus group forged towards fostering more in-depth conversations around interdependence and buy-in from the community. We designed surveys, and over 600 4-page surveys were distributed, with 230 being returned, which is a 38% return rate of a paper survey. Later, I will represent a summary of some of that data. We also held stakeholder interviews, and these were key to accessing the gaps and integrating diverse voices into a holistic, practical hub design. Over 130 local interviews were held. We heard the lived experience of seniors, people with disabilities, our First Nations, health centers, tourist associations, taxi companies, medical transportation services, local small businesses, church communities, family and community social services, food banks, youth groups, schools, recreation and community associations, Alberta Health Services, chambers of commerce, women's shelters, EMS and first responders, mental health, social workers, and peer support liaisons. And we had some very important conversations with Alberta Social Development and Planning Council. That was comprehensive. A broad regional and national service review exposed a distressing reality faced by rural communities and their residents trapped in transit deserts, which presents a dire situation of isolation and limited mobility, perpetuating significant challenges for residents and hindering overall regional development. And we did hear this morning that transportation is the primary obstacle between the rural-urban divide. The initial intent was to explore a transit system design that supported transit-vulnerable populations known as captive riders, but quickly realized good economic solutions also provided integral opportunities to provide riders with choice as tourists as potential parts of our design. Options such as via rail, the Roam bus, which is the electric bus that goes from Canmore to Banff, if any of you have heard of that famous bus there with the car problem in our Banff National Park. Red Arrow, other charter bus lines, and are geared towards excursions and tourism. Local handy bus services are meeting seniors' medical trip needs, but both are limited in servicing broader community needs or wants. Transit shuttle solutions that do exist are often when simple connections can be made between a small town buttressing a city limit. So for example, we have the Blackfalds with Red Deer, known as BOLT, or Blackfalds On-Demand Transit, or COLT, between Cochrane and Calgary. But these are mostly funded by municipal partnerships. But in our community, where a round trip is 4 hours, closest to a closest city center, these options do not work. Other interesting nonprofit shared ride transit services were Drive Happiness, Driving Miss Daisy, and Rural Rides in Nova Scotia. Rural Rides, which is several individual nonprofit hubs or societies scattered throughout Nova Scotia, operating independently under one large coordinating nonprofit board, operates as a collective. Rural Rides displays important aspects of fluidity, responsiveness, affordability, accountability, and diversity, accessibility, on-demand and fixed route capacity, predictability and interconnectivity, regularity, timeliness, efficiency, and flexibility. And these were the words, these address and articulate what we kept hearing back through the data that was necessary to have a successful transit system. So let's take a look at some of the survey data that we featured. We have actually two handouts that the narrative report that was our report back to Infrastructure Canada, and a draft report that we've put together to share data with the community and to continue building into the future. So some interesting highlights of respondents that we received back in the survey data was, and predominantly those were gathered from community engagement sessions, from high schools, from the trade shows, and from seniors. There was a balance found between the town and county representatives, many of which had lived in the counties predominantly over 20 years, mostly were over 65, and predominantly female. Not a surprise to any survey response. Most hold a driver's license, auto insurance, and do own at least one vehicle per household. 63% never used a local taxi service, and those who do, 37% rarely use it. However, 30% of our respondents said there were not sufficient taxi services available. 55% are not comfortable driving at night or in all seasons or all weather conditions, and 31% stated they require accessible transportation. 76% of the respondents said they already do share rides. Medical, dental, and health trips would be the top contenders for public transit use. So we are not talking luxury trips here for shopping sprees. 44% would use public transit, and 68% would support a public transit system even if they had sufficient transportation themselves. 77% believe equal access to transportation is a human right. 83% believe reliable transportation improves quality for all. And most believe public transportation would be good for our county in regards to employment, health and wellness services, quality of life, mental health supports, cultural opportunities, tourism, community engagement, small business growth, education, and social connectedness. Some of the challenges that we faced that will be found in the narrative report, if you'd like to look later, are indeed the widespread local rural areas and communities, the low population density that wouldn't justify fixed route bus routes and would reduce overall accessibility by only being able to offer on-demand, pre-scheduled options. There is a paucity of existing transportation options, thwarted public transportation landscape, and a lack of potential to build multimodal complex integration. Limited infrastructure and interconnectivity includes also poor internet in rural Alberta. It's a little spotty. And this would also interrupt the use of transit apps and real-time tracking technologies. It's an aging population, and so most of the on-demand transit systems that are successful do rely heavily on these technologies today to make it efficient and effective and reliable. So these would be a challenge to seniors to learn some of those top technological competencies. Economic constraints, of course, we all know in the room, and limited funding resources, the harsh weather of our community, and the last mile connectivity, which is being picked up at your home or residence and being driven to the next closest transit system or bus route available. So these would be still very broad and wide distances, and residents to these transportation nodes would be a significant barrier. A lack of workforce mobility and environmental concerns. We do live in a fiercely independent province with an oil and gas mentality, and trying to sell a shared ride electric bus is really a tough sell. Gathering unbiased community voices from those with next to no transportation to attend our community engagements was the bias that we saw in our engagement community sessions. The people that were there could get there. Inherent friction between progressive and conservative mindsets related to risk, change, and resource allocation is a political landscape in Alberta, probably familiar to all of us as well. So thoughtful dialogue and strategic compromise are vital to overcome challenges, bridge the gaps, and promote sustainable community and infrastructure development. So interdependent collaboration is key. And I think that that's what we just heard with the keynote speaker as well. So we have elements for implementation. Again, that Rural Rides template does work, a nonprofit model that is being in local communities, a nonprofit meeting the actual community needs in that small area working together in a collective where the provincial dollars are, the grant application is written from a collective of each one representing one of those small hubs. I believe it's at this point started in 1989, and they have built up to 29 hubs or nonprofits under that umbrella. So I invite you actually to go home and look up rural rides in Nova Scotia. So we would then use a graduated implementation of these hubs. We might start with one and build out from there, and then interconnect those hub counties with each other. The online portal supports and real-time tracking for a dynamic and non-static solution on an ongoing day-to-day basis. A blended staffing model, because volunteer and employed drivers, often the volunteer drivers are coming from seniors who are themselves snowbirds and continuing to age themselves. And the flip side is that employed drivers require a very high amount of insurance. So you have to balance between using volunteer drivers, low insurance, low cost, but not having the reliability of an employee, and then the paying of the insurance for drivers who are employees. So fixed and virtual routes and stops would be built out with proper technology, and then on-demand and fixed bookings, door-to-door bookings, last-mile bookings. These would all just be graduated. We need to start somewhere. Basically, we could ask the question we heard at lunch, well, why not? Let's begin here and move forward. And then using a sliding scale funding system and a fair entry model. So the next steps, we've narrowed it down to 3, and there's plenty to do. The first would be collaborative work with community agencies, including all 3 levels of government: business, corporate, NGOs, nonprofit organizations, and the public and private entities. 2, advocacy and keeping conversations current by building a collaborative, well-equipped steering committee committed to listening and hearing emergent ideas, research, and hybrid dynamic solutions posed by those diverse voices. And 3, building social capital in conjunction with affordable accessibility by respectful advocacy, patience, and authentic collaboration with multifaceted political, economic, social, and environmental voices for public transportation. So it's about building consensus for dynamic change and fiercely being adherent to a win-win model for everyone. So with that, I'd like to thank you for coming and go back to the Stone Soup motto. So when everyone contributes generously according to their true potential and capacity, healthy solutions become possible. Please take the handouts. Please have a look for the handouts if you like. And our contact info here, make note, or I have business cards here if you'd like to grab one. And yeah, don't hesitate to reach out to us and continue those conversations. I think that they could be well informed across the country. Thanks for listening.
You want to do questions?
Oh, right.
We just want to make sure that we have enough time for Heather to do her presentation as well. So does
How are we
anybody
for
have
time?
any questions? Maybe you can't hear me if I'm sitting down there.
Go ahead.
There's one down there.
Yes. Yeah. Yes. So the hidden homelessness, when we looked at what the data told us, we knew that, for example, when I was talking about the Mountain Rose Center, it's kind of like So the Mountain Rose Center was sort of one recipient of people who were coming because they didn't know where else to go. And the other is, of course, the hospital where I work, because people come to the emergency department because they don't know where else to go, right? And so what we were finding is that there was kind of a core group of people that, when I say hidden, because in rural Alberta, especially where we are, as I showed on our county map, people can go camping all year, right? And so we would only see people when they would need to come in because the weather got really cold all of a sudden, or because they had run out, or because truly there are times where there have been medical emergencies, and then they can be found alongside of the road literally and be brought in by someone else, right? But the other significant piece of hidden homelessness was actually our teenage population, because we would hear things from school counselors, or we would hear from their friends who would be saying, I'm really worried about my friend, right? And so we kind of had those anecdotal stories. And then when we got the research, because it kind of went through a number of different sectors in terms of getting the answers to the questions. And so then we saw that actually the hidden homelessness was more abundant than what we had believed. And so, especially for our teenage population, those were kids that were living in somebody else's shed, or like, you know, sort of like a space in their garage, or they would be moving from couch to couch, friend to friend, but they still had nowhere safe on a permanent basis for them to be, right? So it is something that we've tried to address in different ways, right? In terms of just getting some of that information out there for people to recognize. So our FCSS office has taken on a bit more of that. We also knew that, I'm sure because it has been in the news, so there's a bit of a drug problem in rural Alberta, and maybe in several provinces, but one of the I guess peculiarities of our area is that we fall on what's called the meth highway of Alberta. And part of the reason for that is because up north, so like a little bit north of Drayton Valley, and I know Drayton Valley is also presenting here this week at this conference. So there's like drug production that happens there, but also comes in from BC through the top corridor, moves down through our town, and then goes out or is disseminated through the rest of Alberta. So we end up having people that are using drugs or are involved in the drug trade, and then all of a sudden they're just in our community, right? So we end up having kind of, I guess I would say, different types of needs even within the homeless population itself. So, and then the other, this is something that we don't necessarily talk a lot about, but also our community has a very high rate of suicide. And so we have seen also what happens is that people come to our community from other areas in Alberta because, and as I said, I work as the mental health liaison. So I mean, I not that I'm going to tell horror stories, but what happens is that people come there because they know it is so remote, and it takes so long for people to get to you in terms of assistance that your suicide may very well be completed, right? And so then also what happens is if there is an intervention with that person, if they are without resource, they also then are just in our community because that's the last place that they've received support, right? So when I say hidden, it's not like we knew that, you know, sort of John Smith lost his job and now he and his family, they've gone through all of their savings and they are now without residence. That's a very different kind of scenario than some of those other things that we see. So that was a really long answer to your question.
I want to show also that there's like a link. If you can't get to, like what we heard this morning of the young woman who said that she had to go into the city to get emergency crisis supports because she couldn't get supports in her own remote community. So transportation is the key to people getting on time to their mental health appointments, to their doctor's appointments, to the supports they need or the women's shelter. So that when things start to fall apart, the proactive preventative piece was that they could get to the supports that are available, and they don't or they can't. And so then it all falls apart and into pieces and they find themselves on the street.
Heather, you're up.
So Heather Hay, she, her pronouns, is an educator, writer, human rights activist who has built strong networks in communities locally and nationally. As the coordinator for Elder Abuse Prevention Muskoka, Heather worked with the Senior Women Living Together Network to explore housing options for older women with funding from Canadian Women's Foundation through the Investment Readiness Program Systems Change Stream. Heather works with Prompt, Muskoka's anti-poverty group locally and nationally, as a past president of Fierté, Canada Pride, the National Association of Canadian Pride Organizations, to coordinate conferences and events to elevate and empower unrepresented voices.
Okay. Stop this one.
Oh, she knows what she's doing.
She does.
You're like
I'm gonna try. We got a couple open there, so. My PowerPoint is one slide, so let me show it.
Nice.
Slideshow from beginning. There we go. Basically, I've got a report. You can download it from there in both English and French from the webpage. I'll stay here so that I'm not messing up the camera. I started a project that was kind of interesting. I got a phone call from somebody saying, we need a charity partner. So there was a group called the Senior Women Living Together Network, and they wanted to apply for funding through the Investment Readiness Program. And I'm a charity, and this is a group of older women, and they figured, here we go. So I figured, what the heck? Sounds like fun. It was a fascinating project. So the first project was just, to develop a business plan or try and find out some way to use social financing so that the Senior Women Living Together Network might be successful long-term, and not just like so many of our small town organizations dependent on that one person giving all of their time and energy, and as soon as that person steps away, the organization fails. So we're trying to create sustainability. And in our first go-round, there was a lot of information that was gathered, but all of that information belonged to the Senior Women Living Together Network. It wasn't necessarily publicly available. So when the next stream of funding came around, we decided to go for the systems change stream and look at this at a bit bigger scale and see what is the options for older women living in rural communities for housing, because most of the housing options are policies and stuff are designed more for bigger communities, right? There's not much in rural communities, specifically for women. And again, can you hand me my sippy cup?
Yeah.
Thanks. Thank you. So we applied, got the grant, and off we went. And we thought we were going to come up with a guide that was going to be like how to do the Golden Girls anywhere in Canada. Right? Like if you're in Newfoundland, here's some resources, supports. If you're in BC,
Golden.
So it was sort of going to, that was what we were doing. That was what our goal was. And you can see the name of the report is now called Failure to Cope. Okay? It is because what happened was in the time, just in the writing of the report, so the Senior Women Living Together Network, how their model works is she finds housemate groups and gets people together and finds a group that seems like they're going to gel, gets them to visit each other in each other's homes, deal with there's so many things to think about when you're going to enter in one of these arrangements. So she has all of these housemate groups, and in the time from when we started to when we went to write the report, she couldn't find any housing for these groups. Housing prices had gone to the point where even combining income, older women do not have the resources to access funding in the current market. A little bit scary, so we kind of, did a little bit more research, and in my community, there's like 500 women's shelters across the country. 15 of those deal with older adults. And my local shelter will not take older adults who have any health needs whatsoever, right? Do you know what they get in Muskoka? If the shelters are full, the district will give you money for a tent. That's what you get. That's your housing solution in Muskoka. A tent. Nowhere to park it, nowhere to use the bathroom. Here's your money for a tent. That's your solution to housing. So there's got to be more, right?
Nothing's better. Actually, yes.
Well, so it got a little scary, and we found like there's a shelter there's a few elder abuse shelters, 15 I think for older adults, but there's one in Calgary, and even with all the resources of that shelter, they can't take in new clients because they can't get housing for the people they've already got.
Yeah. Wow.
And that's with a team of looking for housing, making sure all their paperwork, their taxes, like all of the, right, working to get these folks. And they're turning away hundreds of people because they can't house the ones they've already got in the shelter. Out in BC, Kirby, I think it was, or I won't use the names, there was a survey done on people who had been evicted, right? Because we know that the rent evictions are happening, right? And of the people surveyed, 40% of the people who were evicted were not able to find housing. That means they're going into underhousing or homelessness situations. And the numbers, they didn't have it specifically for older women, but the majority of them were older folks, and they were not able to find housing for the older women, essentially. So we kind of had a few, a little bit of a, what do we do, right? Like, there's got to be something that's being done. And what we found, every researcher we talked to was like, oh, there's no data. Let us know what you find, because we can't find anything. There's data on older adults, but that includes older men who have the pensions. They have, the higher incomes of a lifetime. Like, there's a lot of reasons why older women live in poverty. Because they took time off to have their kids. If they were divorced or widowed, they lose the house, all of those things. So they're often the ones who are in a rental situation and vulnerable to a rent eviction, right? And as soon as they lose that guaranteed, whatever their rent is, and have to find a new situation, they just simply do not have the funds to find someone. And then trying to find somewhere to come together is another gong show altogether. Some of the things we found was that we tried to focus on the go-go's. Like the financial people talk about seniors in terms of the no-go's, the slow-go's, and the go-go's, all right? So the slow-go's are the ones in long-term care, retirement homes, that kind of stuff, or the no-go's. The slow-go's are sort of maybe in a facility, they need a bit of support to stay, and there's resources for folks who meet those criteria. But for an older woman who doesn't need support, wants to live independently, nobody is talking about them. We did a search of the municipal housing plans and did a search for the word senior. Do you know how many housing plans don't even mention seniors, let alone older women? Right? So I'm not here to offer any solutions. I'm just here to scream for help, because women are dying already because they're not getting housed properly. They're living in cars, and they do not consider themselves homeless. These are women who they worked as bank tellers and secretaries and teachers and nurses. That's other people. Like, I'm not homeless. That's somebody who's not a contributing member of the community, right? So they don't want they don't want to apply for rent geared to income, or there's a lot of pride, and so they're not accessing the programs that are available, even if there are some, they don't want to get into the RGI housing, that kind of stuff. They would rather live independently. So we found basically there weren't much to deal with them. A lot of times the housing is urban focused. We don't look at rural solutions. And we really thought that there'd be a lot more solutions happening And it was just a matter of going out and figuring out what are they doing in this community and bringing those resources. But if they are coming up with solutions amongst themselves and within their smaller communities, they're not being documented and they're not being shared. So we weren't able to gather the research on that. One of the other parts, in terms of affordability, there's a lot of reasons why women are poor, as I said. They also tend to live longer, right? And they live alone longer, right? Men tend to, I think the numbers were something like 19% of men live alone versus older women, or older men, 32% of older women live alone, right? I'm sort of flipping through it here. In terms of policy, there's a couple of things that we found, like there's the jurisdictions between province and federal and municipal. It's a gong show. And no, because older women, especially of that generation, who are the most vulnerable right now, they are not used to speaking up and advocating for themselves, right? They'll go and volunteer at the soup kitchen, but they're not going to take advantage of the services. So they're not organized in fighting for their rights. So that's why I'm kind of trying to raise the flag a little bit here. The part of the problem is how we measure poverty. As people age, you can't compare. There's a couple of different measures. One of them is the basket of goods, right? Well, in that basket of goods that they decide this is what a family needs, and that doesn't include the extra cost of medications or depends or all of the other medical and health needs. They can't drive their own car anymore, so they do need to use transportation if there's some available, right? Because I'm in an area where there is no transportation. One of the things that the Maytree did the report on poverty and measuring it, and they're recommending that there be a senior-specific measure of poverty, so that we're not lumping them in with a family, that kind of stuff. And one of the other things that would be helpful is a broader housing benefit, right? That $2,000 a month sure made everybody's lives a lot easier during COVID, and especially for older women. So having a guaranteed income, some kind of benefit that would help older women be able to afford, because there was one of the stats we had, many older women are spending over 80% of their income on housing, if they can get it, right? And it's supposed to be 30% to be affordable.
80%.
Huh?
80%.
Yeah, over 80%, yeah. Yeah, no worries. So there's a whole bunch of stats in the report and stuff. If you want to see the details, I'm just kind of flipping through here. Like the woman that I worked with, Pat Dunn, who was on the Senior Women Living Together Network, an amazing human, right? And her story, she's one of these, she was a nurse, she gave up, she and her husband went and lived on a boat, right? And then he died. And so because they'd been living on a boat, she'd lost connections with her other network. Her one child has addictions or mental health issues and stuff like that, so is not able to provide the support. Because we all think, oh, well, you just go live with your kids. And that's not it, especially with addictions in a lot of our communities. A lot of our seniors in my community are raising their grandkids, right? So it's not like they can count on their kids to support them as they get older. And Pat, was a nurse, but had taken time off to have her kids and that kind of stuff, so just didn't have the pension. And so she's tried to find ways to bring people together to find housing solutions. So a lot of the solutions are Band-Aid solutions, and there's more options. If you've got money, yes, you've got options, right? If you own your own home, you've got some options. But even there's many older women who, if you're living in a rural community, a lot of times your house is going to be older. It's going to be 1945 or earlier. Means it needs renovations or upkeep, right? So a lot of the housing that women are in are often, if they do manage to own their house, they don't have the equity to keep it going or to keep it safe, right? So how can they, so they can try and rent a room. There's various models for that. There's some community models where like you can try and do it privately, or there's some community models where like the municipality will try and find housing for university students or for workers in a community through getting them extra renting rooms out. But then there's the liability, so the districts don't want to be liable if it's so there's, and the safety issue, that kind of stuff. And some of the issues that happen when they do the Golden Girls thing, one of the first things to go is your sense of smell, right? And if you have incontinence issues, you may not know that you smell as strongly as you do. And how do you deal with a roommate? You know, did you put that in the agreement, right? You know, you smell of pee, right? It makes for a toxic living environment. So creating the structures to coexist in healthy ways, knowing when, like at what point can we live independently, or at what point does somebody need to sell their share? So if there's sort of two models. You can go where you co-own a house, right? So the Golden Girls model out of Port Perry, they were a bunch of women who wanted to buy a house and do the Golden Girls thing. And the municipality had a law that said, nope, you can't have two people who aren't related owning a property. So they took it to the human rights, and it's called the Golden Girls Law, I think, essentially. And so they've got it overturned, but there's still some parts of Canada where it's illegal for women who are not related to co-own a property. But you also can't get that loan cannot be covered by the bank, right? So you have to have the equity yourself. There's a lot of challenges there. So there's, there's some options to try and share if you own your house. I know there's one developer who's working on creating a unit where each person would have their own sort of self-contained unit, and then they have a bigger kitchen and living room on the main floor with a guest suite for any company that might come. But do you know what the starting cost of that one of those units is? $640,000. That's not affordable housing. Like, it's a housing option, but it.
Yeah.
And maybe if you lived in Toronto and you have a very, a house that appreciated, you might be able to sell that house and then downsize to something like that. But that's not a realistic option for many senior women. So that you can try and co-own, messy. You can try and co-rent. If you're going to do that, you want to make sure that everybody's on the lease so that you're protected in terms of being evicted, all that kind of stuff. Again, you need agreements for figuring it out safely. Tiny homes, everybody thinks that tiny homes are the great solution. We have reinvented the trailer park. That's what we've done, okay? Without the sewage systems.
Yeah.
Right? Because I guess you've got a composting toilet, and some tiny homes can be hooked up to the grid. But in Muskoka, they're closing the trailer parks because of the inadequate septic systems, and they want to try and turn the properties over into resorts. But to reinvent the trailer park, it seems kind of silly in some ways. It's a viable option. It does allow greater density of housing, so you could put up, and there is one we saw that was it's like a fully accessible unit, and it could be drop it in your yard temporary. You've got like a granny flat for, so there are some options. Again, for somebody who's, I don't know, they go from a house, that downsizing process is always a bit painful and scary, as you know. So going from owning your own house to renting, so small groups of women can do the co-ownership. They can try and do the shared rental if they don't have family or some other options. But basically, if we're looking further down the road, co-housing and cooperatives are sort of a longer term solution that might offer more benefits. One of the problems with a lot of the housing initiatives is they'll have an initiative to first-time home buyers, right? But that house is no longer affordable when they sell it, right? It doesn't create stock of affordable housing. It just goes back into the regular pool. So the programs that are being funded are not creating sustainable long-term affordable housing. In terms, we looked at social finance, different ways that it could maybe be involved in creating housing, sort of creating a land bank or so somebody has an older house and their husband or partner has died, and they would sell it to a land trust and then rent it. Like they're sort of negotiating some options that different groups are looking at, but the legal piece and all that kind of stuff is a little bit sketchy. And again, you still have to have the owning of the existing house. The idea, though, is that that house would go into a trust to keep it affordable for older women after you. So you could rent out of your house, like you basically sell your house to the cooperative, and then that money comes off your rent, and the cooperative keeps the house afterwards, right? And they can keep it as affordable housing for a targeted population. I guess our problem is the system is broken, and nobody's doing research on the intersection of older and women. And so we're just raising a flag, hoping that somebody out there will include, at least in the master housing plans that all these communities are being paid to develop, at least put senior in it, if not senior women. So, any questions about that lovely, chipper state of affairs?
It's tough, eh?
Yeah, it's really tough. Yeah. So, the report's available in French and English. I did notice that the French version of it on the webpage had an English cover, but I have fixed that, so it should be available online. So please take it, share it. If you're, doing more research, I'd love to talk with anybody who's, looking at other options. We're looking for those Band-Aids because oftentimes these older women will not take advantage of some of the supports that are in place because I'm not one of them. So, anybody have any questions? Yeah.
You had mentioned about, initially trying to do the research work for when you were preparing this report. And, looking across the country or wherever you could find information and obviously not finding a whole lot. Where did you find, were you successful in finding any information, and where was that located for you? Like if it was in your home province?
We found there was somebody in Newfoundland who's doing a neat little project, and there's the fact that they actually had an elder abuse shelter in Calgary, trying to find the different pockets. But in terms of what older women are actually doing, they don't have a webpage. And we don't have local newspapers. I don't know about you, but there's no local newspaper in any of my region. All we get is Toronto news, right? Not helpful.
And that's why I understand there's no centralized, bibliography or database
of programs or solutions. Yeah. That's what we thought we were going to get. And so we ended up writing this report about 2 or 3 times. So.
And that data from the survey of all the municipal development plans, do you have that available?
I can see what we've got because I know we did a Google search of a whole bunch of municipal plans and
yeah, that's
just
very
did a
interesting.
search for the word senior and didn't find it. Because we just thought, well, maybe the communities, because they're doing these master housing plans, they'll have it, right? They didn't even have senior in their plan. So.
Has the option in secondary suites helped at all?
It has in some communities, but it's creating more density in some of the, like if they've got a family member, that kind of stuff, putting some grants that help people renovate a place so it can be a secondary unit, those kind of things. But they're small scale solutions. Yeah.
And they're often in the basement.
Yeah, and the stairs and all that kind of accessibility, right? It's trying to find accessible units, and also to change the building so that instead of having one primary suite, that there's two primary suites, right? Make it maybe a bit smaller, but having, changing how we design our buildings as well would be helpful. So, thanks everybody. Appreciate your time.
Thank you.